The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there.
Hello, everyone, and welcome to Unravelling. This is a podcast that looks at the world through the lens of mental health, seeking answers and overall, most importantly, understanding for all of us. I'm Mary Wilson.
I'm Kurt White.
And today we're continuing our discussion that we started last episode about mental health needs in the transgender community.
I can't wait. What's on tap for today's episode?
I had a really powerful interview with Dallas Ducar. She's a psychiatric nurse practitioner and the founder of Trans Health, a transgender health clinic in Western Massachusetts. She's a faculty member of several nursing colleges, and as a fellow of the American Academy of Nursing, she contributes to health policy related to equity, ethics, and affirming care. And as a trans woman herself, she really gets to the bottom of how she envisions healthcare better providing for trans individuals, both mentally and physically.
You know, this idea of talking to people with lived experience is something I hope that we do a lot more of on this podcast, to try to center those voices, especially anytime we delve into a topic, I think, to try to really get at it through the lens of people who have actually experienced many of the things that we're talking about. You know, I'm remembering very often some of my mentors were subversive people in the field that were trying to make the field more welcoming and progressive to others, but had to work with systems that were just really profoundly unwelcoming. You know, there was to get to gender-affirming care wasn't something that really even existed outside of a few places, like in the 90s. And there were things even called gender boards that hospitals had to have groups of people without lived experience deciding whether or not people could get care. And that was sort of the environment I was trained in. And learning about the work of Dallas and people like that is tremendously inspiring, and also reflects such a sort of profound shift in the way that we think about things.
In your work as a therapist, is there sometimes the battle between what you've learned or what has been institutionalized and juxtaposing that with what you hear from your clients or patients?
I think mostly I often have to get what I've learned out of the way to sort of find the person in the work. And I think there might be parts of my training that are useful for that, but they come to me as images of mentors and people that I've loved and who have made room for me and taught me how to make room for others, and very little to do with things that maybe we might call a technique outside of that. You know, I think it's a sort of a funny profession because I think done well, it's like a spark that gets lit in a person that, as Plato said, thereupon sustains itself. And I think it's a sort of a way of being with somebody. That's my hope always with the profession of psychotherapy. And maybe there's a similarity there in your field of journalism.
Yeah, definitely. In journalism, that's the most important thing, is talking to the person who is impacted. And again, that's just what we're doing today with this interview with Dallas. A quick note for our listeners. In this interview, we do briefly touch on suicide and substance abuse. Dallas, thanks so much for being here.
Thank you so much for having me. It's such a pleasure to be here today.
Quite the resume you have, and we're talking about mental health today, but physical and mental health for the trans population often do go hand in hand, as some people suffer mental health challenges because of the lack of gender-affirming care. And I know you have a deeply personal story related to this. Are you willing to share that with us?
Sure. Yeah. You know, when I was growing up, I had never even heard the word trans or transgender. And so I didn't even know that it was possible to be able to have words that really fit my own identity. It wasn't then until getting to Charlottesville, Virginia, the University of Virginia, where I went to school, that I began to actually understand that there were healthcare services for the trans community and that trans was an identity. Immediately, when I was in a nursing school class, was just glued to the presentation on gender identity and had words, had an understanding, had a realization that what I'd experienced most of my life that I didn't have any language for was right there in front of me. Then at that time, I was lucky enough to be able to find some services at the University of Virginia, but it took time. It took effort. At that time, there were many different roadblocks. I was an adult. I was able to provide informed consent. But despite that, I was required to go seek out therapy. I was not necessarily struggling because of my gender identity at that time, but it was a part of the clinical policies of that clinic. That process is called gatekeeping at times in the trans community, when the medical community puts up roadblocks in many different ways that then prevent people from being able to access the care they need without having some type of validation of their own identity. And these roadblocks exist everywhere. They can exist in processes and workflows, in the way that insurance operates, the way that different institutions operate, and they don't usually exist for non-trans people. Usually, non-trans individuals can, for example, get access to hormones without any difficulty at all. But that's just not the case for the trans community. So it took time, it took effort, it took my own advocacy. I was a very medically literate individual.
Wow.
And it still was not easy in that respect. And this was the only place within hundreds of miles that provided access to competent care. So I was one of the lucky ones and still experiencing barriers, difficulties. And it doesn't stop there. Once you get access to care, you still are a patient that is going through a medical system in many different ways. And there were tons of times where people would misgender me, where my pronouns or my gender identity were not up to date in the chart, where I was told that there was not a way to do that. When you have difficulty getting access to care, you can struggle with a lot of different things. And for many people, they struggle with depression, anxiety, substance abuse. And for myself, there was, prior to being able to get access to care, significant depression that very quickly began to resolve after getting access to care. I knew I was on the right track. I eventually found communities that were extremely supportive and was able to live the life that I had always wanted to live.
Wow.
Be the person that I always knew I was.
It sounds like that access to care could have literally been life-saving for you and so many other people.
100%. What we know from the literature is that access to competent gender-affirming healthcare is absolutely life-saving.
And those roadblocks, the barriers, they're kind of woven into the network of the healthcare industry, it sounds like, that are invisible to so many of us who don't have to go up against them. Does it all stem from the stigma?
Well, it depends where you are, I would say. There's different legislation in different areas. We know that federally, according to Section 1157 of the Affordable Care Act, individuals cannot be discriminated against based on their gender identity or sexual orientation. So there are federally laws that prevent against discrimination. Now, on state-by-state basis, we see some of the largest amounts of anti-trans legislation across the United States, much of which does specifically target access to evidence-based gender-affirming healthcare. Last I checked, I believe we were around 590 anti-trans bills. That's 590 out of 50 states. I don't know of many issues that have so significantly swelled in a way like the anti-trans legislation that we see. That isn't just stigma, right? That is an overt attempt to sow disinformation and to politicize an identity to gain voters ahead of elections. So that is very different than the misconceptions or the stigma that people have. There may be implicit stigma and biases. There may be many misconceptions in healthcare or otherwise. I think for a long time, there was a history of the medical community not seeing healthcare needs specifically for the trans community as medically necessary. And it's not until really the past 20 years or so where we've seen significant progress in the understanding of the medical necessity of gender-affirming healthcare backed by science. And since then, we've seen, at least in more progressive states, more understanding of the medical necessity of gender-affirming healthcare. And then you start to see more public policy that's in support, more legislation that works to ensure that care is paid for and accessible. And thereby, when you see the reimbursement exist, you then are able to see more coverage for medical necessity, right? And that's really the arc and the history of this, is the research, the legislation, the public policy that supports it. And then from there, you see more incentive for individuals to then be able to provide this care. And that behavior change and that educational change takes time, especially when we still see so many clinical training schools, nursing, medicine, wherever, not necessarily integrating this into the curriculum.
And you're on the faculty of many of these nursing colleges. What do you hope for the up-and-coming generation of medical professionals? What should they know?
Well, I really hope that, in general, LGBTQ healthcare is integrated within curriculums. And I would like to see a national curriculum and different boards and associations that set the national curriculums to really integrate LGBTQ healthcare throughout every module and training. So it's not the one class that folks have. It's not the one time that you go and hear from the LGBTQ person, the trans person, and then that's it. But it's a consistent thread throughout the curriculum. Because really, when you have a one-off class, for example, then people don't really retain that. People don't normalize that. People don't understand that, trans people can be pregnant, for example. Or not every trans person is necessarily going to have a mental illness. Or that a child can come into a well child visit and talk about gender identity. And that's okay. It's not that that child's necessarily trans, but the clinician should be really skilled in being able to talk about it. And so in general, being able to integrate gender identity in clinical training is vitally important, and to understand that just because someone talks about gender identity does not necessarily mean that they're trans. Just because a trans person comes in to a visit, it does not necessarily mean that that person's healthcare needs are going to revolve around their identity. In fact, there is a phenomenon that's well documented known as trans broken arm syndrome, where a trans person came into an emergency department with a broken arm, and the clinicians were so focused on the individual's gender identity that they did not tend to the broken arm, and that person was discharged. So there are these misconceptions that clinicians have where they may overemphasize someone's trans identity, and the outcome is worse care.
Wow. So you want those healthcare professionals to look at the human as a whole being and not just focus on maybe their gender identity.
100%. Yep. Really, what I often say is gender-affirming care is comprehensive care, right? It's looking at all parts of the individual. I was trained as a nurse, and nurses like to pride themselves on being holistic, being comprehensive, understanding the biopsychosocial needs of the individual. And to really do that, that means actually attending to all parts of the person. It's not just talking about mental health, talking about physical complaints, but also understanding someone's individual needs, their values, their identity. People have increasingly become a square box to be checked off in an EMR and a list of complaints. And we have turned, in many parts of healthcare, people's needs, their human needs, their experiences into checklists. And while that process might be important, it loses sight of the humanity. It loses sight of the individual. It loses sight of why so many of us went into clinical training in the first place. And so to be able to talk about someone's identity is rare in a clinical setting, but I would argue when medically important or necessary should be done. And to be able to ask for name and pronouns, to be able to provide your own first so the person can be comfortable, to be able to be practiced and skilled in being able to speak about someone's sexual orientation, gender identity without any bias. Gender-affirming care is not rocket science. It's paying attention, listening with compassion, responding appropriately. And in my mind, that means attending to that whole person and being able to ask them, who are you? Where do you want to go? How do I help you get there?
Mm. And I like how you said it's not rocket science. It's almost like if one of these trans people just feels that support and believes it from a medical healthcare professional, how far can that go? Just that feeling of support.
Yeah. I mean, there was one person who told me that he never realized that when he came out, some of his best friends would be his primary care provider and his therapist, right? So many people in the United States suffer from loneliness. There's an epidemic of loneliness that is occurring right now. And this is amplified in the trans community, especially for those who literally do not have anyone to turn to.
Mm.
So it's all about being able to foster that trusting relationship, because you may be the only trusting relationship that that person has. We know that in the trans community, without support, suicide attempt rates can go up to 40 to 50% for an individual. And we see that number go back down to the national average when having access to support.
Wow. You have so many anecdotes in your personal experience, and you've kind of been on both sides of this issue. When you were transitioning, did you face discrimination? Did you face mental health challenges in that process?
Yeah, I did. I really struggled for a big part of my life with depression, with isolation. I could put on a happy face and I could play the part, but internally I knew something was wrong. It took a lot of time for me to be able to really understand how those experiences of just trying to either shove things down, to repress them, to try to cope with substances had been a part of the suffering that I was feeling, that gender dysphoria. And it was amazing to be able to feel the other side of that, to the gender euphoria, as I call it.
Mm.
It's not that you necessarily hit a point where it's all good, but when you experience that gender euphoria, you're on the right path. And oftentimes when I was providing psychotherapy and psychiatric treatment to patients, I would really inquire as to where they experienced their own gender euphoria in some way, to encourage them to almost use that experience as a compass in some way, and to help them to better understand where they felt right in their body and when they felt right.
Mm.
The amazing thing for me, it's not everyone's experience, was how quickly things were able to get better in my own mental health, how I became so much more motivated, so much more directional, so much more free.
Wow. Can you even imagine where you'd be today if you didn't have access to that care?
I'd probably be dead.
Wow.
Yeah. I could not see a future forward. And I think that's the same shared experience for many people. I oftentimes talk to other trans folks about the idea of trans superpowers. The superpowers we gain through the resilience of really difficult experiences.
Mm.
It may be the resilience that we gain through that struggle. It may be the ability to not necessarily just see things in black and white, but to be able to see the world in more gray. It may be the ability to just cherish each day that we have because we are alive.
Mm. And is that sort of where your advocacy comes from, those superpowers? We need, more people like you who have this lived experience to help shape and envision that future of what healthcare could be.
Yeah, I think it's where my advocacy comes from, my entrepreneurship comes from, the desire to actually create real systemic change. It's not just in speaking up, though that's important, but it's also ensuring that there is direct action that's taken too. It's why at the end of every single talk I give, I ask people, what is one change that they will commit to on that day? Because we need less talk in a way and more action. And that's really what inspires me.
Wow. And Dallas, if people are listening today and they want to help advocate for more gender-affirming care, in what spaces should they be advocating for this? And what are some concrete steps they can take to help?
Yeah, well, it's really important to remember that an affirming model of healthcare is really that return to humanistic care. And you can start today with these takeaways. First, remember again that affirmation is not rocket science. It involves these specific 3 steps: to listen, to respond with compassion, and to pay attention. It's important to remember that we are not the ones that decide if the patient or the client feels safe. It is up to them. So always starting by introducing your name and pronouns. I call them universal precautions. Just like when you walk into a hospital room and may wash your hands, or a clinic and wash your hands. Also walking into a space and introducing yourself with your name and pronouns. Then also being unafraid to ask open-ended questions. Being able to know and internalize that we are not the ones that are going to make the patient feel safe with a rainbow pin or, a trans flag or our pronouns on our badge, even though that's important. But it's up to the patient to feel safe. And so perhaps even asking the question, I understand that this may not be the safest, this may not feel like the safest place to you. So what can I do to make this more safe for you? And this also means providing services for institutions to provide services that are comprehensive and allow people to be honest, authentic, and curious. We have to affirm people's humanity despite gender identity and sexual orientation, because patients are more likely to show up when they experience that biopsychosocial wellness. Patients show up, they're more real, we're able to be more real. And so what I always recommend is for people to start from a space of shared values. Have conversations with people that you may not always agree with. Don't shy away from those. Not having conversations with the people that are vehemently anti-trans, you're not going to change those minds. But the group of people that I call the movable middle, the group of individuals that are truly able to perhaps change their mind, to think about something differently. As we learned from COVID, it's not the science that's necessarily going to change someone's mind, although it's really important, but it's the stories, it's the narrative, it's the ability to engage with people and communicate with people.
And having those important conversations. We know that you're out there telling these stories and having these conversations. So we really thank you for being on the podcast today and for all the important work that you're doing, Dallas.
Thank you so much for having me, Mary. This was a great conversation. To anyone out there who's listening, who cares, who wants to make a difference, we need you.
So I thank Dallas again for that really powerful conversation, and joining me again is my co-host, Kurt White. And Kurt, I know you just finished listening to that interview. What did that bring up for you?
Wow. It was very powerful. Actually brought me to tears. As I said a few minutes ago, as I came to your office, I think feeling of gratitude for people who are courageous enough and are able to make space for the humanity of others in their lives, especially when they're actively invalidated in a society, in a medical system, sometimes in a mental health system that doesn't even do the basics.
She really emphasized that we need to foster those trusting relationships with medical professionals, with therapists. Moving forward, is that something that maybe you're going to shift your view on or continue to do in your work?
Oh, yes. I'm very grateful for this interview you did with Dallas. I think it brings up so many important things. Even in places where we're very well-intentioned, we're still very, very much working on in this field. I think the inclusivity, centering the voices of others in a really deep and meaningful way, is a sort of a process, not a checkbox. It's a thing that you have to, I hear her saying, is meant to sort of shift your thinking. And I think, we have a long way to go, honestly. I think we have some training programs here. And as I'm listening, I'm thinking, how good a job have we done to sort of center the experiences of folks in the trans community or with other differences that the world is very invalidating of. And I'm thinking of a lot of really specific things that we might think about differently if we really challenge ourselves to do that.
What have you learned about creating safe spaces for people to explore their identities?
That's a great question. therapists mostly learn from their patients, actually, and thank goodness we do, or clients, or whatever word we use. In part because I think the training doesn't always get at that explicitly, which I think is part of what Dallas was saying in a way. Some of what she said sounded so obvious, and yet it actually hasn't really been adopted by many people in really meaningful ways. I hear her saying, trying to get beyond the sort of symbolism of it into sort of actually thinking about things like curriculum, into things like how do we as a field actually decenter the sort of cis voice, as a part of the way that we think about the way the whole field works. And I think, honestly, most of us are just scratching the surface of that. I think it's a subtle but powerful calling in to do this work in a more comprehensive way.
Dallas did such a good job just breaking it down so we could all understand and naming those 3 things that we can all do, which she says it's not rocket science, really. Responding with compassion, listening, and paying attention. It sounds so simple, but yet it can be difficult.
It's really true. It reminded me of an old mentor of mine who used to say, he said, Kurt, they call us shrinks, but they should call us expanders, because we're really trying to help people have different ways of understanding their experiences in their lives, right? And sometimes that starts with very basic and fundamental kinds of welcoming. The idea that maybe we're the only person that, as a therapist who's been able to really be there and center somebody else's experience in a really meaningful way, right? It's almost like a kind of a friendship that maybe people haven't had an experience of in the rest of their life, right?
That really spoke to me when she said that loneliness is an epidemic, but it's so amplified in the trans community. And like you said, a professional, a medical professional, a therapist, if they're that opening, validating person, that might be the only person they have like that to speak with.
That's right. And if loneliness is an epidemic, it feels to me it ought to be a solvable epidemic, actually, right? I mean, it has the effect of a metastatic disease, but it's not a metastatic disease. We can fix it by changing the way that we think about making room for others, about connecting with others, about validating others' basic experiences.
And some of that validation seems just so simple, asking people their pronouns or identifying your own. Those were some of the solid practical steps that everyone can walk away with listening to that interview.
Why would we not do that, right? Why would we not call people what they want to be called? Why would we not make a certain basic amount of space? Why would we not sort of assume, in training programs, for example, that not everyone is the same and maybe has sort of different needs, and we have to educate ourselves about that in a systematic way? It feels like they have become cultural touch points, but they really shouldn't be cultural touch points. These are not controversial things. The affirmation of one person's humanity doesn't diminish anyone else's humanity. It's a sort of a fear, I think, that's at the root of a lot of this.
Yeah. And I know she was really encouraging for medical professionals, just that humanistic approach. And she was kind enough to provide a lot of resources and also resources for clinician education, training materials for clinicians on transgender healthcare. We'll list those in our show notes, but she also mentioned a few resources for people who might need support, including GLAAD.org and translifeline.org. Number there is 877-565-8860.
Those are wonderful, and thank you for sharing those.
Yeah, we thank Dallas for opening up and truly for all the work she does. It's just amazing to follow her journey, and you can find her on social media, Dallas Ducar, and follow her really inspiring journey. Thank you all for joining us. I'm Mary Wilson.
And I'm Kurt White. We'll see you again soon. Unravelling is brought to you by Brattleboro Retreat and is produced by Charts and Leisure.
Find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.